Well, influence means spreading your message, trying to convince people, which is in politics important, of course, because you want to convince voters to vote for you so that you can represent them in your work in parliament. And of course, also to negotiate with other political groups to obtain majorities, finding compromises and change legislation. So influencing is actually, I think, core of our work as politicians. Of course, it has sometimes negative connotations because it is subject to manipulation or to, all kinds of techniques that can be used to manipulate people and to, in that way, try to influence them. Personally, I came to politics quite late. I have an academic medical background. I've been 30 years working in reproductive medicine as a gynecologist at the University of Ghent. So I came into politics because of conviction, I would say. And I think that by, starting from, first of all, facts and figures and knowledge and science, because that's my background, that you probably have a better base to convince people than if you are not using the evidence which is out there. That's the first thing. Although my experience tells me that sometimes people don't want to listen to the evidence. They don't trust scientists a lot. In this crisis now with the COVID-19, I hope this has been a bit different now, but still, experts and scientists are not always followed blindly, and that should not be the case. There is limitations there as well, and politics is more than just science. The second element, besides, I would say, knowledge and facts and figures and science, the second element is authenticity, is, I would say, passion. When I, do some things in my political work, I do it out of passion. If I don't feel the passion, I will not invest in it, or I will not really take up these subjects as the core of my political work. I came to politics, for instance, because I was worried about the effect of the environment on human health. I'm talking about chemicals, endocrine disrupting chemicals mainly. That's my I would say number one driver in politics, and it's very, of course, a very important subject today, as you know. And if I would lose that passion, that conviction, I think I would stop politics. I don't have any interest. I can go back to university anytime. So that's, and people feel that. I hear that from my followers, from the people that I talk to, that they can make the distinction between somebody who's just working towards the next elections and using all kinds of populist tricks for that, or people that are in politics out of passion. Of course, I understand now I'm influencing you by saying that. You just have to believe me or not, but you don't have to listen to what I say. Just look at the actions, and I would say do that for all the politicians. Follow them in their work, not just on their social media. Although we're now talking about social media, which brings me to the next ingredient, if you want, which is, of course, the tools that we have today to reach out and to talk to our followers, our voters, the public at large. And these are the social media. It's very tricky. There is a lot of fake news out there, a lot of bad or negative influencing people. The facts are there. They look at social media to follow the news, and this is really something that can be colored and manipulated. You always have to check the sources. I think it's an important message. But we as politicians have, of course, to play that game. If you're not on Twitter, if you're not on Instagram, if you're not on Facebook, you will lose a lot of possibilities to discuss with the public, to engage in the political communication that we have. So you have also to master that, whether we like it or not. We have to use the tools of today to speak to people. And then maybe the last point, has also to do with this authenticity and the passion. You can't give up if you're really convinced of something. And for me as a green politician, this is really also the hope that we really can change things for the better. That means that we're not going there where we think the gains are. We're going there where we think we need to be for the next generations for the out of care for other people and the next generations, the planet as a whole, and never give up. I had the chance to speak with the Dalai Lama 5 years ago in a personal talk with him, and I remember that was always his motto, and I took it over. I mean, never give up. I mean, there will be bad days and you will lose some battles, and in politics, of course, it's like that. You don't always have majorities for your points of view, but if you're convinced of what you're doing and you're not playing games, you cannot give up. And people will, again, they will see that, they will notice that, and they will appreciate you for that. And in that way, if that's part of the influencing, this is a better way of influencing and getting to your goals than playing games, playing tricks, not being honest. People at a certain moment, they will find out about that, and they will not. You will not be successful. In many instances, first of all, because of the subject, of course, we're talking about health, and as a medical doctor, I've been in that domain for, honestly, more than 30 years, 34 years almost. So yes, this is my background. I can understand. I have, dealt with patients all that time. I'm still seeing patients on Fridays. I know some other colleagues do as well. So it is extremely important to understand what is at stake. And I have in my academic career a dual experience. As a basic scientist, I have done a lot of work in the lab, and as a clinician talking to patients, I have also experience of the psychology that is important in the relationship between doctors and patients. And that is more than just the science we're talking about, because people make decisions based on a holistic appreciation of what their problem is, what possible solutions are, and so on. And that brings me immediately also to politics, because this is exactly the ingredients that you need to negotiate and to do your political work, I think, in a good way, to take into account the human factor, to understand where are the barriers, why is this proposal not carried, why are people misunderstanding, maybe I should explain it better, maybe I should take away some suspicions or anxieties or whatever that can be barriers in advancing together. So it has helped me to be, I hope, a good politician. And secondly, it of course helps me in the health issues, because I understand healthcare, I understand public health, I understand the science of medicine and biology, and that is clearly the basis. We started with that of the knowledge that you need to speak about a certain subject. It's very difficult in politics, and we have to do it sometimes, and some people do it all the time, speaking about things that they don't understand. But again, that's not very authentic, and people will feel that as a politician you're speaking about things you don't understand. And I think it's very logical that if you look at the health domain and you look at politicians that are most influential, but you could also say successful or active or whatever, that these have a medical or paramedical or biological background. I think it's not a surprise. Yeah, that's a more difficult question, to be honest. I think that it probably reflects the fact that health has become an incredible priority for the public at large. If you look at the polls and what is really important for people, even before the COVID crisis, because now it's clear, if you ask people what is most important for you now, it's of course this Corona crisis, this COVID crisis, and everything that comes from it. And so health is now number one priority for everyone, but even before it was. And we know that the EU has limited competences and we're heavily debating now, of course, if we should try to enforce the competences of the EU in health domains. Maybe that's going to be your next question, but it is very logical that if it attracts more public interest and the people are really thinking about their health and what can be done better in the public domain, that it will also be a political priority. And this is why the EU, the Commission and Parliament has been now, definitely in the last months, but even before, putting health higher and higher on the agenda, which means more and more politicians have been interested in it. That's one part of the answer, I think. The second part is, of course, that if you talk about health, healthcare, public health, we're not only talking about, the science, the medical science, biology, how to develop drugs and vaccines. That's part of it. But it is a very large social, psychological, and you name it, domain that is extremely important. It has to do with the interaction between people. It has to do with the workplace, and there the EU has a lot of competence, health and safety in the workplace. This is something that we work on in the Employment Committee in EMPO. I'm, by the way, a member of ENVI and EMPL. I'm also chairing IMCO, which is interesting, Internal Market Consumer Protection, where health is not the number one priority, but health touches upon so many domains that this is the reason why we also call for a kind of health in all policies approach. That means whatever legislation we make, we have to look at the impact on health, on inequalities, on access, on affordability of drugs, and so on. I mean, there's so many things that touch upon health that you can find them in so many committees and on so many agendas of politicians, that this more, social aspects indeed will attract more people being active on it, maybe than just the ones that are really the experts working in envy on the legislation. Yeah, I think it's important if you don't reach out to people, and I would say especially young people, they're very, very active on the social media, then you will not reach them. They will not know who you are, what you're doing. And then, of course, your political influence, your social and political influence will go down. I mean, we as politicians represent the population, the people that have voted for us. So it also comes with a responsibility to give feedback on what we're doing and to try to engage in a dialogue, because they can, criticize us for what we have been doing or ask explanations and so on. And before, probably, 30 years ago, they wrote letters, and sometimes some of them still do, and a lot of them sent emails. But today, it's of course Facebook messages, it's Twitter messages, it's all kinds of social media interaction that brings you in contact with people. So yeah, if you don't use these tools, you will definitely be less visible as a politician. And well, if you say, I want to be elected, I want to have a large voter base that supports me, then you will have to find a way to communicate with them. And that is the way of communication of today. And again, as I said, many people consider their social media as the number one source of information. Now, political parties all over have understood quite well, and the ones that invest most in these social media, I mean, there are studies that show that they have, a lot of success because of that. We also know that there is a lot of influence, without which I would call really populist, especially from more radical parties that heavily invest in that. And I'm talking about my own country, but I'm sure this is the case in many other countries. So if you really target the social medias and young people, that will definitely make you stronger as a political party. I don't think it should be an aim in itself. That's the bad side of it, and that's the bad side of politics in general, I think. I'm a bit older, probably still a believer of engaging in a discussion with people, starting from facts, from conviction, and trying to explain why you're doing what you're doing, and trying then to convince them, to follow your points of view and to support you once they have to vote. But it can be manipulated, and we know that, elections are even being influenced by foreign countries, and not to name them. So this is something we have to be very careful about, because this is a threat to democracy and rule of law in the end. We see that happening in certain countries. So that's something we have to be very careful of. It's a good thing if you really want to spread your message, I would say, and you are positively motivated, but it can be manipulated, and it can be a very dangerous thing as well. So yeah, it's up to us to regulate it again, to make sure that we don't have foreign influences, when we have elections, and that hate speech and fake news is really filtered, that somehow it will be taken off, and social media platforms are understanding this more and more, and governments are regulating in that direction more and more. So these are all new technologies, new ways of communication. It takes some time before we find the good equilibrium to really have all the advantages of these systems to reach out to as many people as possible, because that's of course the main thing. Yeah, I think so. Without the social influence, you will not be elected in parliament, and then your political influence will be zero. I mean, if you're invisible, nobody knows who you are, you will not be in parliament. So yeah, of course they are connected, but I would also turn it around in a positive way. Your political work, you need to give feedback to your voters, dialogue with them, and that is done on the social media. So I'm a believer in the positive aspects, and we have to be careful to contain the negative aspects. But the whole system is very much connected, of course. I don't think that if you have zero social influence, that you will be a successful politician having a lot of political influence. I think there will be a connection between both, and I'm sure that if you have the data and you can follow it up over time, you can try to find correlations there, and there will be, maybe not the 100%, but there should be a correlation that's to be expected. Well, then I would, since we're talking about social and political influence, start with the social influence, make understood to people how important health is, how the competences are, what the EU can do and cannot do. Because the first question that I was receiving in the crisis is, why doesn't the EU do this or that, and why are we not seeing the EU? Well, then you have to explain that it's the member states that have the competence, and if they don't want to listen to the recommendations of the EU, well, then borders will get closed, and masks will be kept, and whatever happened during the crisis. You have to explain how Europe works, and how there is always this tension between the European level and the member state level. That's the first thing to do. Second thing is, of course, that you can be critical and say, well, we all probably underestimated the crisis in the beginning, and some of us were maybe a little faster in understanding what was going to come than others. But in the end, the EU did do a lot. And let's not talk only about the funding and the money, and not the pledging for vaccine and therapeutical development, but also in trying to ask the member states to open their borders again. This was Breton, we discussed in IMCO, in the Internal Market Committee, all along, trying to make sure that consumers were protected over the borders. There has been a lot of online sales going on. So the EU has really done a lot of work to keep that open space, which is the Schengen space, which is the single market, to keep it alive, because it was not only threatened, it was also the solution to get us out of this crisis better. If we work together, we are stronger. I mean, I am a firm believer of that. I don't think that we can do things better on our own if we're talking about cross-border crisis like this virus that doesn't respect the borders at all, of course. And now we're having the discussion again on opening the borders and tourism and the contact tracing apps and so on. So we're still having that discussion all the time. I think as MEPs, because that was your question, we should explain that to people, to raise awareness about what is at stake, why collaboration is better, why the EU should really have more competences so that we're better prepared for crisis in the future. So in terms of crisis management, there's a lot, that we can do to enforce the agencies that we have, the Medicines Agency, the ECDC, all these agencies that are in place to help member states to have a coordinated response in case of crisis like that. That's the first thing. Secondly, personally, I think that we should now also use the momentum that we have, because people are so aware of the importance of health, to also put other things on the table that have to do with health and in a cross-border context. And here I'm talking about prevention, for instance. We are already doing a lot on environmental criteria, on tobacco use, on alcohol use, and so on, to make sure that the health of people is better preserved. The EU can do a lot there, and we should now maybe make people understand this is the time to really put health much higher on the political agenda within the treaties, because I don't think today we should say we need to revise the treaties, because that's a lengthy process and nobody even knows what that would lead to. But within the treaties, within Article 168, which describes what the EU can do, you can interpret it a bit broader than maybe is done today, and you enforce the possibilities of the EU to take action. Well, first of all, if you don't have a medical background or you're not working in this, educate yourself, work on it, study a lot to understand what can be done. Get some passion about it, because it is important, and maybe some people have really been, now with this COVID crisis, very close to other people that have died or been sick, or we have seen the elderly care, what happened there. So maybe it could have awakened something in MEPs that have not been working on that classically. It definitely, hopefully, will have led to more support for these issues if we will start working on them. But again, for me, it is so important not just to work only on the legislation and fight with the member states and the Commission. I mean, that's our job. That's technical. That's what we are paid to do for. But I think that the other thing is explain to citizens what we're doing here, why it is important. Just spread the message of why it is so important that we're doing this job. And I think all MEPs could take up that message and convince their voters, their constituents that working on health at European level really is an important and valuable thing to do. So yeah, I would call for motivation, for passion for this subject with my colleagues, and hopefully after this crisis a lot more people will even be involved and active in this domain than before.